My name is Bridget, I'm one of the education officers here. And your teacher mentioned that you had been here before, is that right? Okay. Alright, well the purpose of this introduction is just to give you a bit of training about how to view the specimens when you go into the museum, so you know what you're looking at, and how to best get information from them. So part of this introduction is also to let you know how to behave appropriately in the museum, which I don't think I need to go over too much with you guys. It's mainly for high school students, but just to remind you that you do need to have appropriate respect and dignity for the specimens when you go in. They are specimens from real people. So any comments that you make, just keep in mind that there may be members of the public in the museum as well who may have personal experiences with that disease. So keep that in mind. Okay, so we are a museum of human disease, which means that we don't have specimens of healthy organs. So unless you're an absolute expert in anatomy, and I'm not either, it's sometimes hard to figure out what organ you're looking at because it's so affected by disease, and sometimes it's hard to tell how the disease has affected the organ if you don't know what it looked like in the first place. So I'm going to take an organ out of our mannequin. Let's just go through a brief run through of what a healthy organ looks like versus the diseased version. So who can tell me what this organ is? The liver. Very good. And can someone tell me what the liver does?
Filters blood.
Yep, filters blood. What is it filtering out of the blood?
Impurities and toxins and...
Impurities and toxins. What sort of impurities and toxins are we talking about? What's an example of one?
Alcohol.
Yep, alcohol is a big one. Also drugs and chemicals that may be taken on prescription or otherwise. So this is what a healthy liver should look like. What are the characteristics of this liver that tell you it's healthy?
The shape.
The size, the colour.
So shape, colour.
I would have thought feel, but I don't,
Yeah, well, true, it is
so.
true. If you were the pathologist actually doing the autopsy, you feel the specimens, but you probably won't get to feel any of the ones in here. But the texture is definitely an indicator. And also, so colour, shape, size and texture are the main ones. Alright, keep that in mind. I'm going to show you a disease one now, so you can see the difference. So have you guys seen this one before?
Yeah.
So this is a severely diseased liver. What characteristics have changed in this one?
Everything.
Swollen.
Shape, colour.
Right.
All of those four things that we pretty much talked about
Looks
before.
like KFC.
Is that sauce? Yeah, it's a gin. Yeah, well, it may look like something that you have eaten in the past, but that's not an appropriate comment to make because this is a specimen from a real human. So we'll just keep the comments to a minimum.
Okay, sorry.
But yeah, you can see all four characteristics have changed, and in particular, the texture has changed. All those little bumps are little scars on the liver. So where the liver cells have died, if there's too much toxin in the liver responds by making a little scar around it. Someone with this size liver may also have a bit of a bee gut. Yeah. So, given that information, what toxin do you think we're talking about?
Well, alcohol.
Alcohol. This guy had a bottle of brandy a day.
Wow.
So, yeah, pretty intense alcoholism, and this was over, several decades that this sort of damage was caused. Does anyone know what disease this is?
Cirrhosis.
Yeah, cirrhosis. Now, this is a non-infectious disease. Can anyone think of an infectious disease that might cause damage to the liver like this? Yeah, hepatitis. So, Hep A, B and C all affect the liver, but in particular hepatitis C, because it's so chronic, The other ones tend to be transient infections. Hep C is usually a lifelong disease, so it can end up with serious scarring of the liver like this because it happens for such a long time. Okay, so we've done the liver. Now we're going to do another part of the body. We can remember. Yep.
Aorta.
Yep, this is the aorta. So it's the artery which connects your heart and then pumps blood from the heart to the rest of the body. And you can see it splits down the middle here. And where does that split go to? Yeah, the legs. Who can tell me what's the cause of death for this person?
Cancer.
Sorry, what did you say after that? Heart attack? No. This person can't see the heart. So any pathology of a heart attack you'd be able to see in a heart. Yeah, or a blood clot. Yeah, same thing. So you can see all that clotted blood in there, and this person had a genetic disease, which meant that their blood clotted like that. So on autopsy, they had 5 clots in the one leg alone. But this is a really good example. Even though it's not a healthy specimen, parts of it are healthy. So we can use this as a reference. It's nice and smooth on the inside, it's all one colour. Okay, now we looked at a pretty healthy aorta. This is the diseased version now. So who can tell me what disease they think this is?
So this is the aorta down the middle.
This is the aorta, cut down the middle like the other one.
Wow.
Yeah, fat deposition. So it's a particular type of fat called, starts with C? Yeah, cholesterol. That's stuck onto the inside of the aorta here. Remember the other one was nice and white and smooth. This one's sort of a yellow, all different colours. It's all textured. So it indicates disease, and that's because of the cholesterol that's attached to the inside of the artery wall. You can also see that the shape has changed. Has anyone got any idea what this, there's sort of a tube there. Starts off as a single tube and then goes down to a Y shape at the bottom. That's actually artificial. Do you know what that is?
Adaptation.
It's an implant.
Oh, really?
It's like it's a stent, because a doctor has identified this person as being at risk, and they've put in that stent because the walls are so weak because of the fat that's there to try and keep the artery open and prevent it from bursting. So this particular disease, has anyone got any idea what the name of this disease is? Starts with
Sclerosis?
Yeah.
Arteriosclerosis.
Yeah, atherosclerosis. Very good. Arterial sclerosis is, I think, when that fat starts to calcify and becomes very, very hard. This one, I'm not sure how they distinguish between them, but this one's just atherosclerosis because it hasn't begun to calcify yet. So. What I'm going to show you now is a video of some surgery, and this surgery is of a person's femoral artery, so the artery running through their thigh. And this bloke, his name is Sid, he's about 80 years old, and he's having some plaque, cholesterol plaque, taken out of his leg because he came into hospital with a dodgy hip. He's coming to have a hip replacement, but before they do that, they need to clear out the vessels in the surrounding area to make sure there's no blood clotting the socks over the heel properly. So I am going to turn this on, just for your purpose. I'm about to show a video of some surgery. So
excellent.
If you find it too full on, or if you start to feel a little bit queasy, all you need to do is shut your eyes for about a minute.
We've done the bottom end. Now what I'm doing is going to plug the top end up. However, it feels very rocky. And I think we're going to have to do what we call an endarterectomy, which is clear out the vessel and get rid of all the plaque.
It looks like the Great Barrier Reef.
So that's what we call coralline plaque, or, as Rafi said, what is it? The Great Barrier Reef. So just in here, and that's what we're going to take out. And you can see that. That's all that plaque, which is years of smoking, coming out. What's in chain, thanks. Now it's going a little bit longer. Can you take, there we go. And And you can see there, it's got a nice tapered edge, so we've got all of that plaque out nicely. And that was what was in his artery causing the blockage.
So you can see just how hard that fat becomes. And it weakens the walls just because it doesn't sit just on the inside, but it penetrates through the layers of the walls. So it weakens it and means that the layers of the walls tend to separate and you can get what's called a dissecting aneurysm. So instead of the wall just bursting, blood gets in part of the way and it makes a pocket in the wall, which is just the start of worse things to come. It really makes the wall quite weak.
You said it was from years of smoking, so...
Yeah, so that one's from smoking. Other risk factors might be, what do you think?
Well, high cholesterol diet.
Yeah, fatty diet, or even a sugary diet, because your body processes sugars to fat, to store it as fat. So if you're not using all the sugar that you eat, your body stores it as fat. So you'll end up with high cholesterol too.
So what is it about smoking that ends up causing arteries?
Yeah, that's a good question, because there's no cholesterol in fat and no cholesterol in smokes. But the chemicals in the smokes change the composition of your blood. It makes it thicker, and it means that the way that your body synthesizes and metabolizes fat, it ends up that there's more cholesterol in your blood. So yeah, smoking is actually a sort of a hidden killer in that respect. You always think lung cancer, you never really think of the cardiovascular side of things. Yep.
And the carbon monoxide in the cigarette, they get high carbon monoxide levels, which is quite a toxic substance, and it damages the endothelial lining, which becomes more sticky.
Oh, and that's
So
what like
more
That wants to stick to it.
Yeah, more likely for fatty substances to attach. Yeah.
Like an inflammation response on the side of the walls of the artery. Okay, and the third risk factor is a lack of exercise as well. You know, if you keep blood pumping properly through your veins and through your arteries, then it's less likely for cholesterol to build up. Okay, so what we've gone through so far is two examples of aortas. One that was pretty healthy but had the blood clot in it. Then the one which was really diseased, which had atherosclerosis. Now I'm going to show you another one, and I want you to give me some suggestions about what's happened to this one.
it's dead.
Yeah, it sort of looks like it's dead because of the colour. And the colour is a bit misleading because it's because of the preservative that was used. So it didn't look like that in the body, but you can see the sort of fat that's built up on the outside, and you assume that there's probably fat on the inside as well. But what about the shape?
Yeah, bubbles burst.
Yeah, so there's a bubble in it, first of all, there's a swelling. And that swelling is probably because of some sort of blockage. Because you imagine the blood flowing from the top all the way down the legs. If there's a blockage, perhaps somewhere here, sort of builds up like a traffic jam. Then it's burst. So where it's ballooned, that's called an aneurysm. And when it's burst, that's a ruptured aneurysm. Has anyone got any idea about what the consequence of a ruptured aneurysm in your aorta might be?
Internal bleeding and probably circulation.
Do you think it would be fatal?
Yes, it was about quickly.
Yeah. In fact, you can't deal with it once it's happened because it will kill within 5 to 8 minutes. So once it bursts, unless you're literally lying on the operating table, open, and the doctor watches your aorta burst, they can't do anything because there's not enough time to get you in a hospital and open you up. So it's, once it gets to this point, there's nothing they can do. The idea is to catch it when it gets to this point. Well, hopefully you keep it nice and healthy like this one. But if it got to this point, the idea is to put in the stent before it ruptured, because there's nothing they can do past that point.
So this would have been the cause of death, presumably?
Definitely, yeah. Because all that blood that's meant to be going to the rest of the body is now filling up the abdominal cavity. So huge internal bleeding. All that blood that's meant to be going around the body, oxygenating tissues, your body will die within 5 to 8 minutes with no oxygen. So it's a very tragic way to go, very sudden.
What's it called?
So it's an aortic ruptured aneurysm. Yeah. Or sometimes they just call it an aortic aneurysm. Yeah. Okay, I'm going to show you another video. This time it's not of surgery. This time it's an appointment between a doctor and his patient. The patient happens to be the same bloke, Sid. And Sid, after he had that operation in his thigh, has to have an aortic stent put in. So the doctor's trying to explain to him what's going on, or what he'll have as part of his surgery.
In your belly, you've got this big bubble. Yeah. And it goes like, sort of like this. Yeah, yeah. It is virtually a big balloon or a blowout of that artery. And this big bubble divides into the arteries in the legs. Yeah. Now, this is abnormal. This is about at least 2.5 times the normal diameter of an aorta at that level. Yeah. So what I'm going to do is get rid of that balloon by putting a straight stent down the middle of it to normalise the arterial flow and just get rid of that balloon and make you less at risk of it rupturing. Yeah. This is the device, or part of the device, that we're going to actually put into your abdomen. That's going to sit up here like so and go into your legs. Okay, and we do that through the groin. And it looks pretty big, but it's scrunched up into a little tube and we release it from inside the artery. So that's the device. Do you want to have a look at that?
And this goes inside the body?
Yeah, it does.
Yeah, yeah.
Up through your leg.
Yeah, yeah.
So what we're going to do is we're going to put a new stent graft to seal that off and get rid of that and hopefully heal it with time, and also at the same time improve the blood supply into your right leg so you can heal the wounds that are going to be created when you get your hip operation down the track.
This is a big job. You got any fellas to help you?
I've got lots of fellas. I've got a very, very good team.
Have you?
Yeah. So it is a big job. Any vascular surgery is really a big job.
Yeah.
So he's quite a cute old man, isn't he?
Yeah.
But it just shows you that when you guys are doing remedial therapy. So you're studying TAFE at the moment, you might be learning a lot of jargon, a lot of technical terms, but eventually when you deal with patients, they will have no idea what you're talking about. So this is a good, if nothing else, this is a good display of how medical professionals need to deal with their patients in a way that they can understand, particularly older people who may be a little bit confused. I'm not saying that he was, but people who don't exactly know what's going on or don't know what's going on in their body. Okay, now I don't think you guys have worksheets, do you? Just coming in to have a look
I think so,
and
yeah.
do your own thing?
Yep.
Okay, so I won't go through what you have to do with the worksheets, but pretty much this slide is just to tell you that there's about 3,000 specimens in the museum, so you probably won't have time to go around and have a look at all of them. So if there are particular ones that you're looking for, come and ask me, and I'll show you where they are. So particular types of diseases or parts of the body. Yep. We'll talk about that in the session later on. Okay, so don't worry too much about this stuff. This is for high school kids. But these are just the final rules of the museum. There's no eating or drinking inside. Not that you feel like doing that anyway, probably. But you can come out and have anything to eat or drink whenever you'd like. That's fine. There's no photography, just because we don't have the ethics to take photos of actual human tissue. So, please don't take any camera phones and stuff away. Don't handle the specimens because, and I forgot to say this earlier, they're put inside a preservative fluid. So you might have noticed that when I lifted up that liver, it was sort of moving around a little bit. It's not in solid plastic. So there are chemicals in here preserving this stuff. So if these chemicals get on you, it's not the end of the world, but it's not particularly good for your skin or your eyes or your lungs or stuff like that. It does have a little bit of formalin, for example, in it. So don't touch the specimens. If you want to see something, I'll take it off the shelf and put it down on the table and you can have a nice close look. I don't need to remind you about the respect and dignity thing, you guys are fine. So, has anyone got any questions before we go in? Okay. Feel free to grab me at any point, but what we'll do is just go into the museum now. I'll let you have a wander for 45, 50 minutes just by yourselves.